Hello everyone, my name is Sejal Sahare and today we are going to study about anti-hepatitis virus drugs. So let us start our journey. First we will know the difference between hepatitis B virus and hepatitis C virus. When we talk about hepatitis B virus, it is a DNA virus, whereas hepatitis C virus is RNA virus. Hepatitis B virus enters into the host chromosomal DNA, whereas hepatitis C virus do not integrate into the host chromosomal DNA. Hepatitis B virus causes permanent infection, whereas hepatitis C virus do not cause permanent infection. It has temporary infection, but it often causes chronic hepatitis. Next, we will see the classification of anti-hepatitis viral drugs. There are two categories, drugs for hepatitis B and drugs for hepatitis C. For hepatitis B, we have lamivudine, adifovir dipivoxil, and tenofovir. For hepatitis C, we have ribavirin and interferon alpha. There are new drugs invented nowadays. We also use them against hepatitis viruses. Now we will one by one study about hepatitis B and hepatitis C. First, hepatitis B. The mechanism of action of hepatitis B virus drug is that they undergo intracellular phosphorylation and inhibits the hepatitis B virus DNA polymerase enzyme, resulting in chain termination. The main aim is to inhibit the proliferation of hepatitis B virus. Now the pharmacokinetics, they all are prodrugs and are administered orally. They are excreted unchanged by the kidney. Now the anti-hepatitis B virus drugs. Lamivudine, first, it is the first line drug of chronic hepatitis B virus infection. It is a nucleoside analog and it is active against hepatitis B virus as well as human immunodeficiency virus, that is HIV virus. Second drug is entecavir. It is a guanosine nucleoside analog. It is also first line drug for hepatitis B virus, but it is differentiating from lamivudine that it has weak activity against HIV virus. The adverse drug reaction of entecavir, it causes lactic acidosis in patient of cirrhosis of liver. These are the two first line drugs. Now the next, adifovir. It is nucleotide analog. First we saw nucleoside. This is nucleotide analog. It is indicated in lamivudine resistant cases. The adverse drug reaction of adifovir is nephrotoxicity occurs or on higher doses and in those with persistent renal insufficiency. This is a very bad side effect of adifovir. The next is telbivudine. This is a newer drug. This is the fastest acting drug against hepatitis B virus, but it has a few side effects also. It is a thymidine nucleoside analog and it is faster in action, but resistance is more likely in telbivudine. The adverse reaction is serum amylase may rise. A very important drug is tenofovir disoproxil fumarate. This is a prodrug. As we can see, it is ester prodrug. It releases tenofovir and this is the most efficacious drug against hepatitis B virus. It is a monophosphate nucleotide analog. It has low oral absorption, active against hepatitis B virus as well as HIV virus. It is used as ester prodrug, which is ultimately releases tenofovir. It has a T-half of 16 hours. Slight increase in serum creatinine is common. This is not much side effect of TDF. Administered 300 mg daily, which produce good clinical and virological response. Due to high efficacy, good tolerability, and low risk of resistance, tenofovir is one of the first line drug of chronic hepatitis. More than 90% of response is seen against TDF. So TDF is used nowadays. Now, next we will see about hepatitis C. The mechanism of action of hepatitis C virus drugs differs from anti-hepatitis B virus drug. The main aim is to attain sustained viral response. This means that we have to produce undetectable hepatitis C virus RNA in blood for at least 6 months after completion of therapy. Now the pharmacokinetics, they have good bioavailability, mainly excreted unchanged in kidney. The first drug that we will study about hepatitis C virus is ribavirin. It is active against all genotypes of hepatitis C virus. Major toxic effect is dose-dependent hemolytic anemia, traditionally combined with PEG interferon for 6 to 12 months. There are various uses of ribavirin, not only for hepatitis C virus, it is also used for influenza, parainfluenza, measles, adenovirus, respiratory syncytial virus infection. Adverse effects are also there. Adverse effects are tiredness, cough, dyspnea, anemia, insomnia. Now the next drug that is very important, interferon. Interferons are produced in body against certain impulses. Proteins produced by viral infected cell, mainly three types, alpha, beta and gamma. Activity is due to inhibition of viral penetration and synthesis of RNA. There are various mechanisms of interferons, but the main is inhibition. Main aim is to inhibit the RNA of hepatitis C virus in the body. Uses are chronic hepatitis B, chronic hepatitis C, AIDS-related Kaposi sarcoma, condyloma acuminata, H. simplex, and H. zoster, and cytomegalovirus. There are also adverse effects of interferons. The adverse effects are flu-like symptoms, neurotoxicity, myelosuppression, thyroid dysfunction, and hypotension. The last but not the least, that is newer acting drug against anti-hepatitis C virus drug. Anti-hepatitis C virus is very temporary in action, but it often causes chronic hepatitis. So we are having new drugs acting against HCV. The first one is NS5B polymerase inhibitor. The name of the drug is sofosbuvir. NS3 protease inhibitor. The name of the drug is cimeprevir. And NS5A inhibitor, daclastavir, ledipasvir, and velapasvir. Now it's time for some questions. The first question is, nephrotoxicity is the adverse effect of which drug in higher doses? The answer to this question is one of the following options. The options are lamivudine, entecavir, adifovir, and telbivir. So we have learned the first drug for anti-hepatitis B virus, that is lamivudine is the answer. Next question, sofosbuvir is newer acting drug against anti-hepatitis virus drug, and the answer is A, NS5B polymerase inhibitor. Next question is, what has the best efficacy and tolerability? We learned the best ester product, that is TDF, which is now used in day-to-day life. So the answer to this question is A option, TDF. Hemolytic anemia is the effect of, this is a very important adverse effect of ribavirin that we have studied. So the option is B option, ribavirin. The next question is, this is the question of this syllabus as well as 8Com. So the question is, the treatment of hepatitis B should be continued till. So the answer is very easy. The answer is D option, 6 months, and we have to continuously analyze the effects of drugs after 6 months. So the answer is option D, 6 months. Thank you so much for your attention. We have studied about anti-hepatitis viral drug. Thank you.